I'm a nurse practitioner. I see patients with, just like Dr. Ghosh does in the office. Mostly I see treatment patients when they start their treatment, during their treatment, and then follow-up. I have been with Dr. Ghosh for almost 10 years. Dr. Ghosh took care of my dad. So I would come with my dad to his appointments. The way my family felt coming to the office, how he took time with us, and how everybody in the office cared what we had to say and what questions we had and took the time to answer them, that drew me to come to work with him. Well, coming from a different environment completely, I thought, first of all, wow, this doctor seems to really like what he's doing. You can tell he's passionate about what he's doing. That was clear from the very beginning. I felt like this was his passion to do this, definitely, where I hadn't seen that before in other physicians I'd worked with necessarily. What I see different about this office as any other practice that I've come across is it is all about the patients, period. I mean, that's what's most important to all of us. We all have that same philosophy, and that's clear in every aspect of how we present this office to the public. Most of the staff that work in our office have a connection with Dr. Ghosh through a family member, a loved one, or an acquaintance that were a patient of his. The Ghosh Center started on the principles of do no harm to the patients, do what's right for the patients, but ultimately patients first. That's the main core philosophy of the Ghosh Center. So in 2011, we were a very small practice and we started not knowing if patients would follow us or not. Got this great community support from the community and patients, and lo and behold, most of them did follow us to our current practice. We get a lot of self-referrals, which is the best compliment to us. If someone else has had a good experience here, they referred a loved one or an acquaintance or a friend to our office, and that is the best form of flattery we can get if someone else has had a good experience here. We do have some physicians and providers in the community that do refer to us as well, but the majority of our patients come from a word of mouth. Cedar Rapids in general has 3 options for oncology care. So the Ghosh Center, how we differentiate ourselves is, I feel like we give good quality care that shows. We provide a personal experience to patients that they maybe don't get in bigger institutions. And what's most important is our philosophy of keeping our patients first. And we do that the moment they walk in the door, and we empower them because they are the leader in their healthcare. So we're empowering them and educating them so that they can make decisions on their own behalf. If patients are empowered through education and they know what's going on in their healthcare, they are all in. They are going to 100% participate. They're going to help us help them. They're going to communicate with us. When anyone gets a cancer diagnosis, they're going to get a lot of opinions from multiple sites, multiple people, and there's a lot of white noise that they have to wade through. But if they are all in and they are empowered and they are going to do better. A patient makes a decision on what treatment perhaps that they want or whatever the case may be, and they're empowered through education to make that choice. Their family's all on board. They're going to do better because they're going to be more apt to stay. They're going to tell us about side effects they're having. We're going to be able to fix things. We're going to communicate better, so we can get them through this easier.
What else do I need to know? What else should we be talking about right now?
I think ultimately that people in the community need to understand that they have another choice, that we are here, that if they do come to us for whatever, we're here to answer their questions, we're here to provide information to them, we're here to empower them to make a decision. And regardless of where they choose to go for their care, they need to know that it's important that they do that they ask those questions, because they should be sort of driving the boat for their own healthcare. They should ask those questions. They should be empowered. They should be educated. And they should be comfortable where they're going.